stability exercises are essential, and the bridging progression is a great place to start. So let's begin with the bridges. Allie, first is just maintaining neutral spine, lying flat, bring your arms up over your head, making sure that the spine and through here stays neutral, let it arch up, that this doesn't happen, all right? So keep that down. Keeping the ribs down. We'll talk about breathing as well, abdominal breathing. Keeping the ribs down is key. That's first. If you can't keep the ribs down and raise the arms up, you're not going to be able to maintain neutral spine as you go into the full progression. So that's why we start here. 1, 2, bring the arms down, bend both knees, basic bridges. Now, we're chiropractic doctors. Everything's about posture. It's about alignment. The knee is aligned with the hip. The knee is over the foot. She's not over here. She's not over here. She doesn't have this going on, okay? None of this. Everything's square. Very important. So we make sure you're square. We make sure there's a little bit of curve, a little bit of neutral spine. There is a flexion bias progression. We're going to talk about using the bridge as a neutral spine exercise, the way McGill talks about it. So, neutral spine, tighten your abs. Perfect. Pinch your butt, bridge up. Hold it. 1, 2, slowly on the way down. 1, 2, 3, 4. A little slower on the way down. Tighten your abs, pinch your butt, bridge up. Hold it. 1, 2, 4 count. 2, 3, 4. And you see how stiff this is when it goes up and down? That's perfect. That's just what we want, all right? Start with 3 sets of 10. We want to build up to 3 sets of 15 to 20, all right? When that gets easy, we add a progression. We'll go to a single leg bridge, which can be done a couple of different ways. Always pre-brace, tighten the abs, pinch the butt, bridge up. Make sure those glutes are really firm, okay? If the glutes aren't really locked in, they can't progress. Straighten one leg out. Keeping the knees right opposite, bring it down. Bring this up, keeping the knees opposite, keeping the pelvis level and down. They can do, and recover. They can do them that way. They can start by keeping, no, keep this guy here. Let's do it so they can see it like that. Keeping the knees opposite, starting from this position, pre-brace, bridge, and then come up. Hold 1, 2, and then slow down. Always looking to see if there's rotation through the pelvis, always looking to see if there's any cheating, all right? As they can do that, the next level is to go up on your toes. And then tighten your abs, pinch your butt, bridge up. So now you're on your toes and down, and I'm going to let you guess what's the next progression after that. So you got it. Single leg on the toes and down. And then once we get into that level, there's lots of variations we can include. We can include using a ball, okay, for an unstable surface, all right? This gets pretty hard, but you can bridge up and then try to straighten one leg out too. Whoop, excellent, good job, and down. You can also do bridges the other way, your head on the ball. That's very good. You can add a band, okay? A lot of times they do this in the gym. Go ahead, wrap that around, use the CLX. A lot of times they do this in the gyms because when you're pushing out and you're bridging, you're going to get more glute med activation. What does glute med activation do? It helps you maintain the femur from rotating internally when you bend your knee. In other words, it helps prevent this from going on. This is going to strain the knees, it's going to give you patellofemoral pain, it's also going to make you at risk for a non-contact ACL injury. That's why they're giving people bands in the gyms to get more activation of the glutes. If your patient has weak glutes, if they have a valgus shift when they do their overhead squat assessment, if when you do their jump mechanics, they load in valgus or they land in valgus, they need to do their bridges this way, which is tightening the abs, pinching the butt, bridging out, and then pushing out against the band to really get that glute activation. And for Allie, that makes a big difference. You can really feel just that little bit of palpation I did on her glutes, you can really feel it made a big difference for her. So that's the thoughtful application of using a band. Sometimes if people are in varus, you might actually put a ball in here. And putting a ball in there is also going to give you more glute activation. So I don't have a ball, but let's just grab this. Put that in there, brace, bridge up, give me a pinch there. You feel you're still getting additional glute activation, but this is going to get more adductors, all right? So if your patient is varus in their overhead squat assessment, if the leg's turning out, if there is a issue with that type of mechanical dysfunction, then you get them to squeeze a ball, okay? But if the patient's favoring a valgus deformity when they jump and hop, yeah, if you put this in there, they're going to get more glute activation. They might get a little more, they're trying sometimes, they do this at the gym because they want to get more VMO, but this isn't going to get VMO. VMO is the last 30 degrees of extension. So that's a failure I see all the time with people that are doing exercises at the gym for knee pain. They tell them to squeeze a ball here. It's going to get more glutes, but it is going to help you drive the knee into the house. So you got to watch out for that. So there's your stability bridges. They work. Be thoughtful. Apply them as needed.